How to crack the RCA. Just to give you a little bit of intro, I passed the RCA back in 2020. Having seen the RCA, how it's evolved, and having done it, I know exactly what are the struggles that you're going through and how it's hard to actually get the right cases. There are things that are in your control and there are things that you can do to maximize your chance of passing this exam. With the RCA, you've got to submit 13 consultations, and each of the consultation is going to be reviewed by 2 examiners, and you can get a maximum of 18 marks for each case. So it's very important to make sure that you're very selective in the cases that you submit, because if you submit a case that's not very good, it can make all the difference between a pass and a fail. So case selection is crucial. Make sure that you're very selective in the cases that you're going to submit. 2 things that you need to make sure that you remember from this session is safe and fit for independent practice. That's the reason why we have the RCA. The examiners are looking whether a candidate is safe and fit for independent practice. So by actually thinking about that, then when you're reviewing your cases and when you're planning to select your cases for submission, make sure that you ask yourself whether the case that you're submitting has got sufficient evidence for an examiner to be convinced that you're safe and fit for independent practice. By thinking through that lens, then you will know what sort of cases would be good cases. There are many challenges with the RCA. Big challenge is not getting suitable cases, and this varies depending on which practice you're working and what is the setup of your clinic. And there are things that you can do to make sure that you optimize your recording for RCA. Second problem is with real life consultation. So the interactions in real life don't go as planned, and sometimes you might find that consultation go over time, or you might find that there's somebody who comes and knock in the middle of a recording, or you might find that your battery is dead and your camera is not recording anymore. So there are various things that can happen with real life consultation. So make sure that you prepare early and plan your recording so that you don't have issues in the middle of your recording. You might come across talkative patient who wants to tell you every detail of their story. So how do you deal with that? With talkative patient, it's very important to understand the reasons why a patient is talkative. So a patient could be talkative because that's a personality. Maybe a patient is nervous, so they're rambling and talking a lot. Or a patient is not very at ease, so they're talking a lot, and you need to make sure that you put them at ease. And if they're anxious or if there's a reason why they're talkative, you need to address that. And by doing that, then you actually make sure that your consultation would work better for your recording. The other problem is you might find that there are patients with multiple problems. Patient usually comes with multiple agendas. So it's very important from the beginning you actually screen for that, because then you can prioritize which problem you're going to address in the consultation. Then you manage the expectation from the beginning. What you don't want to have is you consulted a patient who is presented with swelling of their legs, and then just before they are going to leave the consultation, then they tell you about the chest pain. So it's important to check with your patient, is there anything else you wanted to discuss today? Then at least you're making sure that if there's multiple problems, you're actually managing that and prioritizing it. Other problem that you might come across is patient who won't stop talking. So there are some patients who won't stop talking. You might try to interject and interrupt just before they've actually started another phrase. You can actually interject and tell them, by doing it in a compassionate way, you can actually rein back control of the consultation. For example, if patient is going on about something, then you can say, can I just check with you? I understand that you came for this problem. Coming back to this knee problem, can I ask you about this? So then what you're doing is that you interject, and then you're actually putting the patient back on track with where you want to go with the consultation. If you find that you're having to interject a few times and the patient is still talkative, then it's just not a good case for the RCA. Just accept that some patients are not suitable for the RCA. So don't try to beat yourself up for something that is out of your control. Other problem that you might come across is that some cases might not be complex enough. There are other cases that are too complex that you're going beyond 12 minutes. So finding the right balance about which cases to submit and which one to record is important to consider. So make sure that you're getting complex cases that you can complete within 12 minutes. At the same time, you don't want too complex cases that you can't complete within 12 minutes. Last but not least is a workload pressure. Workload pressure is something that you'll need to juggle as you're doing your RCA preparation. So it's very important to have a good working relationship with your trainer and talk about what struggles you're having and bring solutions to your trainer and suggest things that could help so that you can actually succeed with your exam. Because this is your exam, and if you don't take responsibility for this exam, then nobody else will take. So if you find that there's something not working, bring it up with your trainer and suggest something that could work and see whether your trainer would be willing to try something new. So there are pitfalls that you need to be aware of. Major pitfall is poor use of time. If you're not using your time wisely, then you're not going to score well for the RCA. Common problem is I see registrars dwelling on data gathering, going beyond 8 minutes, and then finding that they're not doing a good job with their clinical management. So it's very important to know when you need to transition to give yourself enough time. Another problem is low challenge cases. You don't want to submit any simplistic cases. There's no point. If you submit a case, a pharmacist or an ANP that could manage it easily, then it's not much evidence to show that you're safe and fit for independent practice as a GP. Another problem that's common is that if you're consulting a case and it's simple, don't try to overcomplicate it because examiners can see what you're doing and you're not going to score well for that. Be aware about patients' needs and patients' wants. So what you want for the RCA is a patient-centered consultation. You don't want a doctor-centered one. At the same time, sometimes if a patient is asking for something, you don't want a patient-driven consultation. You want one that's patient-centered. So if patient wants something, but this is not needed, you need to have this discussion with your patient to tell them that this is what you would recommend and why you don't think having a MRI scan of the head is going to be helpful in this situation. Then follow-up cases should be avoided because you're not bringing anything new to the consultation. It's just recapping all history and there's little information that you're getting out. So I would avoid any follow-up cases if possible. Then be aware if you're doing triage to make sure that you're not submitting any partial consultation. Partial consultation are where you're not making a complete plan and you're waiting for the patient to come down to the surgery to make that plan. So triage is something that would not score you well because consultation is not complete. And then last but not least, this comes down to the poor use of time. If you're using your time poorly, then it's going to affect your clinical management. It's going to be rush and you'll have an inadequate management plan. So make sure that you don't fall through these common pitfalls. It's very important to have a simple approach with the RCA, and that's what we actually go by in the RCA blueprint. For data gathering, what you want to do is to get your patient's story out there. Get the story, let the patient talk, and facilitate the narrative for the first couple of minutes. Once you've done that, then you can pick up on the cues, and then you take a focus history, going down into what's the presenting complaint, going through the ideas, concern, and expectation, and relevant question related to the psychosocial. Once you have got enough data, then you can move on to clinical management. In clinical management, you want to have a shared understanding with your patient, involve your patient in the management plan, and make a safe management. All along from the start of the recording up to the end, your interpersonal skills is being assessed. So you need to show that you are self-aware of your emotion, of the patient's emotion, that you're listening to the patient and you're supportive, helping the patient to make a decision, and you're not using any jargons. So if you have a simple approach and you know what you're doing, you have a framework in the back of your mind, having a consultation framework will help you, then you will be able to actually have a good consultation. So poor use of time is a major problem. Make sure that you fix that. Make sure that you got a stop clock that you can see during your consultation and keep track of the time. Know when you have to transition from data gathering to clinical management. Ideally, you want to do it at minute 6. If you do it at minute 6, then you give yourself ample time for clinical management so that you can score well for clinical management. So a pivotal phrase that an examiner taught me is something that I would recommend you to use. So I know you think you may have gallstone, but I think that it's a kidney stone because the pain is in your loin. What do you know about kidney stone? By using this, what you're doing is that after you have gathered your data, you're signposting yourself that now you're in clinical management. So you're acknowledging what the patient's idea is. The patient thinks that they may have a gallstone, and then you're verbalizing your differential diagnosis. If you verbalize your working diagnosis, then the patient know what you're thinking, and the examiner also know what you're diagnosing this patient. Because if you don't say it, then the examiner has no clue. And you're addressing this idea of the patient, and you're also justifying why you think this is a kidney stone and not a gallstone. When you do that, then you're on the same page of the patient. You're explaining to the patient why you think this is a kidney stone. And then you go on and ask a question to assess the patient's pre-existing knowledge about a kidney stone before you start explaining what a kidney stone is. So what you're doing essentially here is you're doing a few things. So you're acknowledging the patient's idea, you're readdressing it, you're verbalizing your working diagnosis, you're committing to a working diagnosis, and you're starting to develop your clinical management with explanation about the problem, and then you can discuss the treatment plan. Let's go over this case then. Write down in the chat what sort of question are you going to ask this patient. Yeah, you need to make sure that you're asking this question, whether it's unilateral. You need to get more information about what sort of headache it is. So ideally what you want to be doing is you can go through the Socrates to check where the site is, the onset, what's the character of the headache, is there any radiation, is there any associated symptom? For example, is this headache coming with vomiting, nausea? Is the patient presenting with numbness, or is there other symptoms associated? And then you need to ask about the timing on the headache, any exacerbating factors. So your red flags are important to cover. So for example, you need to check whether the headache is worse when they're bending over. Is the headache worse when they're lying flat? Ask about any other problem that they may have. For example, do they have any fever as well? You need to ask all these questions. So make sure that you have a good way of going through the medical history and asking the red flag questions and getting a good picture of the headache. With headache, it's important to ask about any trauma or any injury or any loss of consciousness. Other things that you need to think about is the age of the patient. So this patient is 67. You need to think about your differential diagnosis. So before you consult the patient, the time that you've got, you need to use it wisely. So go through the patient's note. Ask yourself, what's the possible differential diagnosis here? So for a patient who is 67, think about giant cell arteritis. So ask questions whether this could be giant cell arteritis. What sort of question do I need to ask? Could this be something like medication overuse headache? Is this patient who suffers with osteoarthritis taking a lot of medication? So is that one of the possibilities? So there are a lot of questions, various differentials that you need to be thinking before starting the consultation. But once you got a good idea, what are your working diagnoses and how you're going to manage it, then you need to make sure that you bring in what the patient has told you, so that then you've got the ideas, concern, expectation, then you can address it. So use a pivotal phrase that we went through earlier and start your management plan with your patient. So it's very important to think about how you're planning your consultation beforehand. Once you've done that, then you'll find that your cases get better. The other tip I would give you is that if you're managing a case of headache and you're managing 3 or 4 cases of headache in a day, you'll find that your consultation get even better. So try to get similar cases on the same day. That will help you to get better skill at taking a history, doing the clinical management. So that's something that's very important. The other thing is to consider about asking your psychosocial. When you're asking psychosocial, it's important you ask these questions in context. Because if you're asking, how about smoking, how about alcohol, and it's coming across very formulaic, you're not going to score well for interpersonal skill. So a better way of asking this question would be, Mr. Griffith, I understand that you've been having headache. There are things that can affect your health. Can I check, do you smoke? And then the way you're asking it is more in context. So if you're asking it in a way that's relevant, then you'll get a better score for your interpersonal skill. Once you have recorded a consultation, you need to make sure that you review your consultation. When you're reviewing your consultation, make sure that you're using your marking sheet, and then look at what are the things that you need to improve on, and then implement these changes and make sure you're getting constructive feedback. This could be from your educational supervisor. Have an understanding with your educational supervisor what sort of cases that they'll be able to review per week. For example, if your educational supervisor can review 5 cases, then pre-select 5 cases and then let them review it and then get their feedback. So once you have implemented the changes, then you consult again, and then your skills is going to compound, and this is how you get better. So that's why it's important you go through this cycle and iterate as you go along. Don't wait until you have recorded 20 or 30 consultations and then you start reviewing them. You need to be doing it ongoing process, that as you're getting recording, you're reviewing it and you're implementing changes to your consultation. So make sure that you're also reading the feedback statement, because a feedback statement is very useful to think about how you can improve your consultation skills. So the college has got feedback statement that's very detailed. So look at the suggestions and look at what you need to be improving. So this is an example of case submission for myself, and as you can see, I have submitted a mix of telephone and face-to-face consultation. So it's very important that you experiment with both and see where you're getting better cases. So to be able to pass the RCA, it's very important that you use strategy and you don't make mistakes that other people have made. So you can learn from other people's mistake, and this will save yourself time and headache. So the blueprint is very useful. You can go through it and you will learn a lot from other registrars who've gone through the blueprint and passed the RCA. And then you need to take action and execute and implement changes as you go along, and then you'll find that you're more likely to succeed with the RCA. If you're struggling with the RCA and you believe that you need help, then I'd recommend that you click the link down in the description below to book a free call to see whether we can work together on a one-on-one coaching program. If I think that I can help you, then we can get you on the coaching program. But if I can't help you, then at least you'll get some insights. I hope you found this video useful. Let me know down in the comment section if you have any questions or any suggestion. Take care, everybody. Bye-bye.